We welcome you at KCM Hospital Jelenia Góra on our international training bariatric conference with live surgery workshop devoted to metabolic and bariatric surgery for successful therapy of diabetes type 2. We host today surgeons, diabetologists, dietetics, patients, and doctors of our specialization interested in the new achievements of metabolic surgery. We are honored to welcome today as moderator and surgeons, world-famous bariatric surgeons, Professor Almantas Maleckas from Lithuania University Hospital and Gothenburg Hospital, and Professor Wiesław Tarnowski, head of department for general and gastrointestinal surgery and CMPK Hospital Warsaw, and our Dr. Grzegorz Kowalski,
who is not here yet.
Head of our KCM Center for Laparoscopic and Bariatric Surgery. Our conference will be present today using 3D technology and give you a chance for a real-time. Dr. Kowalski.
Good morning.
Give you a chance for a real-time discussion with our very experienced surgeons. The main partners of this conference are Johnson & Johnson Company, an international leader in bariatric technology, and Olympus Polska, an international leader for 3D laparoscopy. We would like to thank our partners for ongoing support and important help for preparation of this conference. We hope you will find this conference interesting and beneficial. Welcome.
Thank you.
Could you tell us, how do you feel about the new trend of diabetes type 2 actually can be cured by this surgery?
I don't think that it is a very new trend. It is just only there enough data which is now confirming that it is true. And we do have the data as well regarding the same, that patients are recovering after the bariatric surgery, those ones who are having type 2 diabetes. Yeah.
O ile do niedawna jeszcze taki widok nie zdarzał się często, o tyle w tej chwili na ulicach coraz częściej widzimy ludzi, którzy, krótko mówiąc, są otyli. Dieta, modyfikacje stylu życia, rozmaite leki, to wszystko daje nam efekt, no powiedzmy, średni, czyli marny, mówiąc krótko, bo nikogo jeszcze z nadciśnienia nie wyleczono przy pomocy tabletek, nikogo nie wyleczono z cukrzycy przy pomocy tabletek i skuteczność tego leczenia, powiedzmy, że jest taka sobie. I oczywiście mamy drugie jakby ramię tego leczenia, czyli leczenie chirurgiczne, chirurgia metaboliczna, gdzie jedną operacją możemy człowieka wyleczyć z nadciśnienia, z dyslipidemii, z cukrzycy, no i oczywiście z otyłości, i dowodów jest w tej chwili bardzo dużo na to, że leczenie chirurgiczne jest niezwykle korzystne.
Czy jest jakaś różnica między operacją dla takich pacjentów, czy czymś się różni?
Operacja jest taka sama, nie ma absolutnie różnic, jeżeli chodzi o techniczną stronę operacji, no bo ona nie może być inna.
Tak.
Natomiast inne jest wskazanie do operacji. Jeżeli mówimy o chirurgii bariatrycznej, to głównym wskazaniem jest otyłość, a jeżeli mówimy o chirurgii metabolicznej, no to głównym wskazaniem jest zespół metaboliczny, czyli cukrzyca, otyłość centralna, hiperlipidemia, zaburzenia gospodarki tłuszczowej i często zaburzenia snu, nadciśnienie, tych składowych jest kilka.
Surgery not only gets a long-term remission of diabetes, but also can prevent diabetes in the group of these patients.
It's a pleasure to be participating in the conference. I think it's a very high-level conference with very interesting presentations, and more importantly also it's a practical workshop where we can show the surgery. And I have done surgery for a woman who has body mass index 47, that is well above the normal, where normal is 25, and she has also type 2 diabetes.
Okay.
As our conference is about the treatment, the most effective treatment of type 2 diabetes, so we have operated this patient with so-called gastric bypass,
Okay.
Roux-en-Y, which is currently considered to be as a gold standard procedure for treatment of type 2 diabetes. What we're doing during the surgery, we are creating a small stomach that is about 20 to 30 millimeter large, and we're connecting the small stomach directly to the bowel. Why it's important? It's important that we're excluding the main stomach, because in the main stomach we have the substance that is called hunger hormone, ghrelin, and the patients, when you exclude the stomach and you bypass it, they get less hunger. And important that we are connecting small stomach to the bowel, because the food goes faster to the bowel, and we have release of so-called hormones incretins, which are very important for glucose homeostasis. That means that they're reducing the glucose and improving glucose correction by surgery. And the patients, if we take into consideration the patients and the treatment, they need much less medications, and in 80% of cases, even they don't need medications at all.
Very nice. Okay, thank you so much for the doctor. So just to understand, so you've been performing the surgery on the operation theater with live streaming, and all the other doctors in the conference room, they could be part of the surgery, they could ask you in the surgery as well. So they had the scientific workshop for them. Also, we had some international doctors here, we had some younger doctors that are not so experienced yet in bariatric and metabolic surgery. So, and a part of the live surgery, we also are having these workshops. You also had the presentation, doctor, about these kinds of surgeries and diabetes also. Yes, the problem of diabetic bariatric patients.
Would you like to tell us a few words about the technology that is used, especially for this particular surgery?
Well, we are happy to witness that this hospital uses Johnson & Johnson equipment, and we are, without any modesty, global lead in this type of the devices. So it's mostly about advanced energy and endocutters. Those two types of products are commonly used in bariatric surgery. We have different lines of the products, and bariatric surgery is one of the areas where usually the best of the best are used, and this is the case also here in KCM. So again, we are happy and proud. Hopefully, with using our products, the results of great surgical skills here in the hospital will be even better. So I believe it's kind of a partnership between the industry and the hospital to have optimal results for the patients at the end.
As far as I'm concerned, it is something new in techniques of doing the bariatric surgery and using the Olympus equipment. We do have in Nairobi one 3D tower, but it is not widely used yet. So, of course, that's what I would see would benefit. Maybe we will start using it ourselves as well. And number two, in general, organization of the clinic job, including organization, marketing, and everything, how the patients are coming here. And number three, of course, in Europe it is much more higher awareness than in Africa, what the obesity is about and how people have to deal with obesity, because it's a lot of cultural gap. In Africa, everybody who is big considered to be wealthy and healthy. So it's this trend is changing.
So it's quite the opposite, actually, isn't it?
Quite the opposite, and definitely all over the world is accepted that bariatric surgery is the main leading way of treatment of obesity.